Good morning from WKYT News. I'm Bill Bryant, and we welcome you to Kentucky Newsmakers. We've had a little taste of winter, and the season certainly is on the way. And later, WKYT Chief Meteorologist Chris Bailey will join us and talk about his annual winter weather outlook. That's in just a few minutes. But first, Kentucky's Health Commissioner, Dr. Stephen Stack, is here. Thanksgiving is later this week as we kick off the season of holiday gatherings, and folks are sharing whatever's out there. It's also a time to think about food safety with those delicious meals being prepared. Dr. Stack and Governor Andy Beshear recently announced the Our Healthy Kentucky Home initiative, and we'll learn about its goals based on some findings about Kentuckians. We're ranked 41st in health, by the way, and Dr. Stack says we can do better. It looks like vaping will come up before the legislature again, and with the new administration in Washington, some changes are coming down the pike. Dr. Stack was a career ER physician before becoming Kentucky's health commissioner right before the pandemic hit in 2020. Commissioner, welcome. We appreciate you coming.
Thanks, Bill. It's good to be here.
And you and I have come together in some very challenging times over the years. We got through the pandemic, including times when people were encouraged during the holidays to socially distance, if not avoid gatherings. I mean, we have to remember how tough those times were not so long ago. It's different now, but another flu and COVID season is here. And as we get ready for those gatherings, what advice do you have?
Well, so the good news is, though the influenza season, the cold season has begun, it's still very mild right now. Folks can go out and still get immunized against COVID and influenza. You can get immunized at the same date, the same visit for those both illnesses. Thankfully, everyone I know, including myself, has had a very mild experience with those immunizations this year, so none of them have laid us up, feeling a little rough for a day. And they're very, very effective. So for COVID, we still know that the people in the hospitals are overwhelmingly people who don't keep current on their boosters. So I'd encourage everyone 6 months and older to get a booster, both for COVID and then also the annual flu shot. And if you are 60 and older or have major medical problems, I would actually urge you to go get both of those shots.
So for those who did take the initial COVID vaccines and may be hesitant now to take another booster, you say that is still recommended?
Oh, absolutely. So influenza changes every year. There's a different strain or strains that are circulating. The same thing is happening with COVID. So the goal is to, one, try to get your immune system prepared for something closer to the currently circulating strain, but also to wake up your immune system and to make it more prepared in the moment to be able to respond. That's what the booster does, is it revs up your response.
Do people underestimate the prominence and the seriousness of the flu? I mean, all of a sudden you can be in quite an outbreak.
So most of us have just a rotten week, right? But a rotten week is a bad week. You get laid up, you miss work, you miss school. If you get the flu shot, well, it doesn't guarantee you won't get the flu. It does make the illness much more mild. So most of us will be back on our feet more quickly. If you're older or you have medical problems, though, could be the difference between ending up in the hospital or not being in the hospital. And that's a big deal, because you get in the hospital, you're obviously sick enough to be there. Second thing is, it's a financially unpleasant experience for everyone who goes through it.
And same with COVID, right? I mean, you're not necessarily preventing it with a vaccine, but you might hold back the symptoms.
Right. So COVID is still the 9th leading cause of death in Kentucky on the most recent full year we had. And it didn't exist, remember, before 2020. So to go from not existing to the 9th leading cause of death is significant. And again, it's more elderly individuals and people who have major medical problems. So they should definitely keep current on the boosters.
We've also had pertussis or whooping cough in the Lexington area where it's been considered to be an outbreak status. Another concern to be aware of out there.
Right, so we've had more than 350 cases known so far in Kentucky. Pertussis is something that for many people just feels like a cold. But for the people who get hit really hard, it's that nagging, unrelenting cough. And for little kids particularly, they can end up in the hospital with it. Every child 2 months and older is eligible to begin the pertussis vaccination series. And if you're an adult and you haven't had a tetanus booster, comes with a pertussis booster usually. If you haven't had a tetanus and a pertussis booster in the last 10 years, you should probably go to a pharmacy or go see your physician and get one of those boosters.
Let's talk food safety as well, as we're heading into the holidays, and folks will be preparing those meals, and some of that may be done over several days, and then the leftovers may be around for several days. You need to be careful how you handle that food, right?
Right. So when you're handling raw poultry, raw turkey, raw chicken, definitely make sure you wash your hands and don't have that touch the vegetables and other things you're preparing when it's raw. When you cook it, make sure you cook it to temperature. I'm not going to know the temperatures right off the top of my head, but that'll probably come with any turkey, and you can find it online. Make sure you use a thermometer and that it is cooked to temperature so that it's safe. And then definitely when you're finished eating, make sure you promptly refrigerate the food and keep it in the fridge until you're ready to consume it so that you don't allow bacteria and things to grow.
And so that's the best practice that consumers can follow, but sometimes within the food supply chain we have some issues. We've recently seen recalls, illnesses associated with contaminated food. Do we adequately inspect and detect the problems in our food supply chain?
Well, I think we take for granted just how safe our food supply is overall. If you think we have more than 330 million Americans eating all the time, and it is infrequent enough that it still makes news when there's an outbreak, so that's a good sign that overall the food system is safe. But yeah, there are problems from time to time, and it just shows the complexity and why it's so important to have a healthy Food and Drug Administration, a healthy United States Department of Agriculture, having entities out there ensuring that our food supply is as safe as we can reasonably make it.
And so that brings us to this. President-elect Donald Trump has nominated Robert F. Kennedy Jr. to head up the U.S. Department of Health and Human Services. He's expressed some skepticism over the years in some areas that some find concerning. What hopes or concerns do you have about public health going forward?
Well, I think it's important for us to continue to say the science and to speak honestly and truthfully and directly with people. We should all make informed choices about our health care. And immunizations are one of the medical miracles. It's a real testament to human ingenuity. We have spared countless lives that would have been lost due to disease, and we have spared even more individuals lifelong disabilities because immunizations have made some diseases either much more mild, eliminated some entirely, like smallpox. If you think about in the old days, none of us know about smallpox now because none of us have ever seen it. That used to kill many, many people every year. And so we really have to continue to remind people how immunizations are scientifically proven, they are safe, they keep us safe from serious illness, disease, and early death, and continue to urge people to be informed and make informed choices to do those things that can protect themselves and their loved ones.
Are you prepared to speak out if some of that is de-emphasized in any way?
Well, I'll continue to advocate for what the science says, and so I certainly will want to make sure that the public knows that these are guidances and advices that I and other physicians and family members that we follow, and that we believe that there is a mountain of evidence that supports that this is what's in their best interest.
Of course, you often said, and even during COVID, that you were following the CDC guidance, but that guidance certainly could change under different leadership, right?
Right, and so this public health system is a complex one. It's local health departments in Kentucky, the state health department, and then the CDC at the federal level, and there are other agencies who share various public health responsibilities. It really relies on all three layers of government working together in partnership in order to keep people informed and to give people information that they can rely upon. And so we're going to continue to hold ourselves to a very high standard at the Kentucky Department for Public Health to make sure that we're processing and receiving information and passing along things that are factual and accurate.
It was said that we were all caught flat-footed in 2020 when the pandemic came along and had to sort of build the system quickly, and then there was thought, well, now we can look ahead, we can start to rebuild our system. Do you feel that public health is in a good place right now?
I think we have not been in this good of a place in a long time. My concern is that in any cycle there's a boom-bust funding and then the funding goes away. It's really important that we maintain the investment in the public health system. We have a highly trained, committed, experienced public health workforce in Kentucky, but if the funding disappears, then the people disappear, and then we lose all that again. And the next time an emergency happens, it's sort of reinventing the wheel all over again, and people get hurt that otherwise wouldn't need to.
I mean, there's a tendency to want to forget it, right? I mean, you look at the flu outbreak of over 100 years ago. I mean, it was like we didn't learn a lot from that in terms of public health. There was a lot of science learned, obviously, but people just want to put it in the rearview mirror.
And that's human behavior. I said this during COVID at those press conferences. I've been pretty clear that I'm a little bit of a nerd and I like to still read my history books, but the science was done pretty well. Not perfectly, but pretty well. It's the human behavior we still haven't figured out. I mean, people get fatigued when there's problems over time. We acclimate to things, right? You get used to it, and then you want to move on. You want to put it behind and move on. And so, we unfortunately have to keep relearning lessons that we have already learned many times before.
Let's talk about the Our Kentucky Healthy Home initiative that you're proud of. First, to acknowledge that we have a lot of challenges in our Commonwealth with obesity, lack of exercise, poor diets. You quantify in your report some of that and make some recommendations. First of all, what's our starting point?
Well, so about 38% of Kentuckians are obese. 1/4, 1 in 4 Kentuckians don't exercise outside of work whatsoever. 45% don't eat at least one fruit a day, and 20% don't eat at least one vegetable a day, and 17+% still smoke cigarettes of adults. And so we've got some real work to do, and those things, physical inactivity, poor diet, coupled with cigarette smoking, those things directly cause cancer, heart disease, they cause illness and shorten our lives. And so if we take focused interventions to make that different, we can all be healthier and enjoy our journey through life more, and we can all live longer and enjoy more of our lives.
And so rather than just a long list of problems and what can be done, you kind of do this in bite-sized increments, what folks can do in terms of small changes that can make big differences.
Right. I think for most people, and if we all know the New Year's Eve experience, right? We make resolutions and then we all promptly forget those resolutions within a few days. It's like standing at the base of Mount Everest and looking 5 miles plus up. So I think we need to make it more actionable. So our steps are very simple, and there's just 3 of them. It's eat at least 2 servings of fresh fruits or vegetables every single day, so 7 days a week. Exercise at least 30 minutes 3 times a day. And then the third one is to be engaged, as in socially engaged. The Surgeon General in 2023 had a report about the United States' epidemic of isolation and loneliness. When we don't feel connected in a meaningful way to each other, we have anxiety and stress and depression, and those things all degrade our health overall, both behavioral and physical. So we need to do these things with each other. And no, it's not on your phone. It doesn't count. You can't be on your phone. You can't be on your computer or your tablet. This has to be real connection. So cook meals together, go for walks together, play games together around a table. That kind of connection helps people to live healthier and longer lives.
So what do you say to somebody who may be out there watching this morning and have one of those issues going on? They're smoking, but they'd like to quit. They don't exercise, but they'd like to do it. What do you say to them to give them the confidence that you can do this? You got this.
Right. So the first thing is, in our Healthy Kentucky Home, we're going to do this together. We're going to try to get as many of the 4.5 million Kentuckians to make this a regular part of our lives. If more of us do it, if we do it together, then together we'll succeed, and that'll reinforce. The other thing is, really don't try to go beyond what I'm asking you to do right now. 2 fruits and vegetables a day. That's it. Just 2 servings of one or the other. That means if you like bananas, you have a banana, you have an apple, you're good for the day. Just set a low threshold and attain it, and make sure you keep it. I'll tell you what I'm doing is I have Apple devices, and so I created an Apple calendar, and I made one just for our Healthy Kentucky Home, and every day I put in the fruits and vegetables I ate and did I exercise. And I'll tell you, I've already got 2 oops days this month where I only had 1.
Uh-oh.
It's harder than we would like to admit.
Sure. And so it starts in the grocery, right? I mean, you have to go buy those items that are healthy, and certainly if you're eating out, you have to make the right choices there.
Right, so if you go to the grocery store, you should not go down any aisles. You should just shop around the perimeter for your food. All the fresh fruits and vegetables and freshly baked breads are all around the perimeter, and that's how you can eat healthy. When you start going down the aisles, it's all the processed foods and the sodas and all the other things. And so I think you have to have a plan. So every Sunday, as I get into this campaign myself, I'm going to start to sit down and plan ahead for the week so I can go grocery shopping, and I can plan and put on my calendar when I'm going to do those exercise activities. So you have to be intentional about it. You can't just hope it happens. You have to decide it's a priority and do it. And by doing it in bite-sized portions like we're doing now, with just 30 minutes 3 days a week for exercise, 2 servings of fruits and vegetables, and then just being socially connected, making it easy and understandable that way, I hope will help more of us to support each other.
And by the way, you even have some holiday ideas, recipes, and meals people can prepare over the time that we're all gathering on that website.
We do. So the website is our healthykyhome.ky.gov. And if you go to that website, each month we're going to have additionally special themes. So next month is going to be next month is going to be heart health, and then we'll have diabetes, and we'll have cancer prevention, and men's and women's health, and tobacco cessation and prevention. Each month there'll be a different focus, but if you go to ourhealthykyhome.ky.gov, you'll be able to see each month's highlights with some special resources to help you along the way.
You had told me that the pandemic derailed some of the initiatives that you so looked forward to when you took this job. You'd been an ER doc for all those years and enjoyed that, but when you took this, you saw the opportunity to make Kentuckians healthier, and then the pandemic got in the way. Is this getting you back on track as to where you wanted to be?
It does, and I may have been in your studio at the very start when we talked about what were goals and objectives. This is the work I thought I signed up for. This is the work I was hoping to achieve. We did the work that was required, it was needed, but I'm glad to have a chance to get back to this. And I should say, I'm very, very grateful that Governor Beshear is supportive of, and in fact was committed to wanting to do this, to make a year-long commitment and to lend his voice and support to this. I think it's really important that we have a governor that's very supportive of all of our health and wellness and really helping us to succeed in as many ways as we can.
Medical marijuana will be rolled out in Kentucky in the coming months. Are you confident that we have the safeguards in place to ensure that some may benefit from it and that it won't be widely abused?
Right, so there's an Office of Medical Cannabis in the cabinet where I serve, and there's another leader over that work. But I am confident. They've created a very robust system. It's from seed to sale. They regulate and oversee every step of the process. There are advisory panels of other healthcare professionals who actually advise on the indications for the use of it and the specific doses and the duration. So yes, I think that if a Kentuckian goes through the Kentucky Medical Cannabis Program, that they are going to get a standardized, reliable, and consistent experience as far as the use of cannabis.
Are we making strides in the opioid abuse crisis?
We actually are. So we had last year a significant decline in the number of deaths, and the early evidence shows that this year is also continuing an additional decline. So the answer is yes, we have made strides, but the other response is we have not made enough strides. So even if we reduce by 10 or 15% the percent of people who are dying, it's still way too many people dying from opioid overdose. So it still remains a tragedy and something we work every day to try to do better.
What are you proudest of in your nearly 5 years as Kentucky's health commissioner?
Well, I'm very grateful in a very politicized world that everywhere I go, I still have Kentuckians come up and say hello and thank you. And I think it shows that if we communicate with people with kindness and decency and respect, we can all still get along and people can appreciate each other for what we contribute. So I'm grateful to Kentuckians for 5 years into this journey with me, for still being warm and receptive, and for making this a wonderful and a job to have and a privilege to serve.
Appreciate it. We miss anything?
No, we've got it.
Thank you. Appreciate you coming in, Dr. Stack.
Thanks, Bill.
Stay with us. We're coming back with Chief Meteorologist Chris Bailey. We'll talk about his winter weather outlook before we go on Kentucky Newsmakers. Welcome back to Kentucky Newsmakers. For many years, our chief meteorologist here at WKYT, Chris Bailey, has done a winter weather forecast for the entire season. So that was this week, just as it was coming down with some snow on Thursday. It's also become a tradition that we talk to Chris about how he arrived at some of those conclusions here on Kentucky Newsmakers, and so we're glad to have him with us. Thanks again for coming in.
Good to be here, and you know what? You nailed it. It was the first time I've given a winter forecast while it was actually snowing. At the time.
It's kind of strange.
It really was. And for snow lovers around here, you know, I'm with you guys. I'm one of you. I hope this was some positive vibes that Old Man Winter's throwing our way, right?
So. You told me that if you had done this forecast a month ago, it may have been different.
Yes. If I had not seen changes as we made our way into the middle of November, this forecast would have been drastically different. Now, I will tell you what the difference is in just a moment after we go through
let me ask
forecast.
You this first of all.
Here, throw them at
How do you do this? I mean, I know you look at some trends, you look at some history, you often talk about years that sort of coincide. So how do you put this together?
I start in the summertime, and I start looking at prior years that have had similar events or similar temperature patterns, and we look at just this year, Bill, and some of the forecast ingredients. 2024 featured a summer that came out as a wash. We had some hot spells in there, but we also had some below normal spells, so it was pretty tame in terms of temperatures. Very close to normal for rainfall. Then the fall hit, and you want to talk about a wild fall. We had dry weather for much of September. We had a month's worth of rain in 2 days from Helene that made its way into Kentucky. and then we hit October and it barely rained a drop, which was one of the driest Octobers on record. And then we made our way into November and all that changed again. We had a lot of rain, we had a lot of active weather here in November, and then I kind of branch out and look at the globe. The Pacific Ocean, the biggest, baddest body of water that impacts our weather, and out there in the equatorial Pacific, there's something called a weak La Nina that has been trying to form. Some cooler waters out near the equator, and they were forecast to become a full-blown La Nina. Right. That has yet to develop.
Didn't happen.
It did not happen, and that has impacted, I think, the overall pattern. So I've labeled something, instead of a weak La Nina, how about a La Nada? Which means I don't think we're going to have a La Nina or an El Nino.
Not much from it.
Not much from it. Those cooler waters have had a big struggle getting together. The other thing, Bill, and it's way away, we go to Japan. They have been enduring some of the hottest temperatures ever over there because of what is known as a marine heat wave. The waters around Japan and in that part of the Pacific have been about as hot as they have ever been in recorded history, and that has impacted the weather. Guess what's happening there? That is starting to cool. So we're losing that marine heat wave that's been there for the past 2 years. So you remember the past 2 winters, we didn't have much.
Right.
So that was one of the changes that I started to see in that winter forecast.
All right, so let's kind of run through this. What is the winter forecast and prediction here?
Well, here we go with locally here in Kentucky, Bill. I am calling for temperatures to average very close to normal, but it's not going to come by just every day being near normal. We're not talking about that. I think we're going to see some massive temperature swings from really mild days to Arctic air in here, and snowfall with an active pattern, active jet stream. I think we have above normal snowfall by just a little bit. You mentioned those analog years. Take a look at some of those. 1983, 85, 95, 08, which I really like, and of late, go back to 2020. That was the closest that we've had in terms of the years to the one that I think is kind of shaping up. And here's what I expect across the country, and we're kind of seeing that playing out over the next few weeks to start out December. Below normal to our north and northwest, the near normal temperatures across Kentucky, and then above normal into the deep south and along the eastern seaboard.
So normal is about what here?
You know, normal,
say January.
Normal temperatures in January, believe it or not, the average high temperature never drops below 41 degrees in Lexington. Did you? I mean, that's kind of crazy when you think about that. You associate January with just frigid days every day.
But you'll have warm days.
You do have warm days in there, and our averages with each passing year start to inch up just a little bit more as our climate continues to change a little bit. The big question that everybody wants to know about, obviously, is the breakdown and the snow chances.
Right.
Well, here you go. Let's break it down month by month. So we're almost to December. We got a really good look at the first 2 weeks of December right now. And what I'm seeing is a colder than normal December. So we're not done with the snow chances. I think what just happened this week with that early season round of some snow is a harbinger of some additional snow shots to come before Christmas. Can we time it out right to where we get one for Christmas? We'll see. And then what happens typically in a setup like I am envisioning, we kind of average it out near normal in January, which would likely be our snowiest month. That is typically the case. Now, February, I think we start to go the other way a little bit with more rain systems and thunderstorm chances, Bill, than snow chances during that time. And then March, well, March, as I say, is March. It's going to do what it does. You get some really warm spells. The average snowfall for Lexington for a winter is 15 inches. Last year we had 7. The year before we had 3. And all of that came at Christmas week.
Yeah.
But then the prior 2 years before that, we had more than 20. So this year, I think we're going to be slightly above that 15 in that 16 to 22 inch range. And of course, the mountains of southeastern Kentucky, we always pick up more higher elevations down there. So, and I think that's going to be the case on that snowfall forecast.
All right, you always love to do a bold prediction, and
I do.
That is?
I do. Hey, we're going to get there.
Oh, okay.
Let me show you. A few Arctic shots for December, several light snow systems that will impact us. And then as we go into January, the highlights or lowlights, those wild temperature swings, big rain and some snow systems roll through. Listen, I think with an active southern branch of the jet stream, stage is set for one of those storm systems, or more than one, to potentially hit us pretty good in terms of a snow event and maybe skewing the overall totals much higher than what I have. February, this is where I think we can get ourselves in a little bit of trouble with thunderstorm chances that would carry us into March as the temperature spikes. As we said, they kind of do their own March thing right there. Now, you mentioned, what are we talking about in terms of the bold prediction? Well, if you look at this, in the TV business, we call that a split screen.
Right.
All right. On the left, you see the snow. On the right, you see lightning and you see stormy conditions. So the bold prediction for this year, Bill, with a active jet stream, Arctic air to our north and warmer than normal air to our south, I think we get one system this year to impact us, one storm system, where at the same time parts of the state are under winter storm warnings. We have another part of the state seeing the threat for severe thunderstorm, and we may have severe thunderstorm warnings and winter storm warnings with the same system.
During that time when you're beginning to try to break out and transition.
Exactly. Now, it has been, we've had that before. It's been a while. So I think we're overdue for something like that.
A few seconds left. We do want people to know we have a commitment here to be on air when needed and to try to spot these situations and cover them when they happen.
That's right. We're going to be here. It doesn't matter the time of day, doesn't matter the day. Holidays, as you know, we're here. You're here.
Right. It's kind of meaningless in our business in terms of time off sometimes. All right, Chris, thank you.
You bet.
And everybody stay with us. We'll be back in just a moment, and we'll wrap up Kentucky Newsmakers. Welcome back, and Chris had a PS. He said if he had done this earlier, he probably would have gone milder than normal, so that sort of shows you how things were trending as he put out that winter outlook this last week. Congressman Andy Barr is a scheduled guest on our next Kentucky Newsmakers program. We certainly thank you for joining us for this edition of Kentucky Newsmakers and hope you enjoy your Thanksgiving week ahead.